Have you ever woken up after surgery and felt like something changed? Not just the normal soreness, not the fatigue from your body healing, something deeper.
Maybe you felt unusually unmotivated. Maybe your mood was different. Maybe you looked in the mirror and felt like you were seeing a weaker version of yourself. And when you asked about it, you were told, that's normal after surgery. Give it some time. And sometimes it does improve. But there is a piece of recovery that many people never hear about: the effect surgery can have on your hormones.
When your body goes through an operation, it doesn't simply see a surgeon repairing something. Your body sees an injury. It activates a survival response designed to protect you.
And that survival response can temporarily change the way your hormones work. One hormone that can be affected is testosterone. Now, testosterone isn't only a male hormone. Both men and women need it. It influences muscle strength, energy, motivation, bone health, mental clarity, and overall well-being.
So when levels drop after a major physical stress, like surgery, some people notice a surprising change in how they feel.
The body's emergency mode. Think about what happens during a serious physical threat. Your body doesn't prioritize reproduction, building muscle, or optimizing energy. It prioritizes survival. During surgery, your stress hormones, especially cortisol, rise. Cortisol is useful because it helps your body handle an emergency. But when cortisol stays elevated, it can interfere with other systems, including testosterone production. The result? Your body temporarily shifts resources away from growth and repair systems toward immediate survival. For some people, this hormonal disruption can last for weeks.
And that can contribute to symptoms like lower energy, reduced motivation, difficulty building or maintaining muscle, changes in mood, reduced libido, feeling mentally foggy.
Many people assume recovery is only about the surgical wound healing, but your body is also trying to restore its internal balance. The estrogen connection. Another part of this story is the relationship between testosterone and estrogen. Your body naturally converts some testosterone into estrogen through a process called aromatization. After major stress, that balance can shift. In some situations, testosterone levels decrease while estrogen-related activity increases. When that balance is disrupted, both men and women may notice changes. For men, prolonged hormonal imbalance can sometimes contribute to increased fat storage or breast tissue growth. For women, testosterone plays important roles in maintaining muscle, strength, mental sharpness, and sexual health. The symptoms may look different, but the underlying message is the same. Hormones influence recovery. Not every surgery has the same effect. The size and intensity of the surgery matter. A small procedure with minimal tissue damage creates a very different stress response than a major operation involving significant trauma. The bigger the physical stress, the stronger the body's emergency response may be. Major surgeries, especially those involving the heart or other large systems, can create a much more significant hormonal disturbance. Recovery isn't just about the operation itself. It's about how much stress your entire body experiences. Pain medication can add another layer. Many people need opioid medications after surgery. These medications can be extremely helpful for managing pain. But opioids can also affect hormone signaling, including testosterone production. So, in some cases, there may be multiple factors happening at once. The stress of surgery, increased cortisol, disrupted sleep, reduced movement, opioid medication. Together, these can make it harder for your body to return to normal quickly. How can you support recovery? The good news is that there are things you can discuss with your healthcare team. 1. Have a pain management conversation before surgery. Pain control is important, but ask your medical team whether a broader pain management approach is possible. Depending on your situation, options may include things like regional anesthesia, nerve blocks, or non-opioid medications. The goal isn't to ignore pain. The goal is to manage it effectively while supporting recovery. 2. Move as soon as it is safe. Movement is one of the strongest signals your body receives that it is time to rebuild. Even short walks after surgery can help reduce muscle loss and support your return to normal function. Of course, follow your surgeon's instructions because every procedure is different. 3. Prioritize protein. Your body needs raw materials to rebuild. Protein provides the amino acids needed for muscle repair and recovery. After surgery, your nutritional needs may actually increase because your body is doing extra repair work. Ask your doctor or a nutrition professional what amount is appropriate for you. 4. Protect your sleep. Sleep is one of the most important parts of hormone regulation. Unfortunately, surgery can disrupt your normal sleep rhythm because of anesthesia, discomfort, stress, and changes in routine. Better sleep gives your body a better chance to restore normal hormone patterns. 5. Know when to ask for testing. Most people gradually recover, but if weeks pass and you still feel unlike yourself, it is reasonable to discuss your concerns with your doctor. A conversation about hormone levels and other possible causes may help identify what is happening. You don't have to simply accept feeling different months after surgery without asking questions. The bigger problem? The frustrating part is that many people experience these changes without anyone connecting the dots. Surgeons are focused on the procedure going safely. They are focused on preventing complications. But recovery is not only about closing an incision. It's about restoring the entire person. So if you felt different after surgery, physically, mentally, or emotionally, your experience deserves attention. Your body went through a major event. Understanding what happens afterward gives you better questions to ask and a better chance of recovering fully. If you've experienced a major change after surgery that nobody explained, share your story. Someone else may be experiencing the same thing and wondering if they are alone.